Assalamu alaikum everyone. Peace be upon you all. It's me again, Bahijah, the Sheibanee, your BCBA. I hope you all are staying safe and healthy. So today I'm going to talk about the role of a BCBA when dealing with clients who are intellectual or developmental disabled. Okay, so first of all, the BCBA needs to conduct some sort of assessment. We have different kind of assessments that we can actually conduct to figure out where exactly the client or the individual falls short, and then we work from there. So we need to find the deficits of the clients or of the individual before we implement any sort of intervention or treatment plans. Okay. Some of the assessments have curriculums that you have to actually follow. Sometimes you have to actually create your own program based off the person's age, capability, and deficits, and then you put in place for their individual. So, after the BCBA has conducted their assessments, and then you know what the individual needs, you go from there. As I said before, ABA is actually focuses on improving individuals' quality of life. It makes you have a quality life. We don't change the individual, we change any maladaptive behavior that the individual might be engaging in. So we teach you the right things to do and not to change you as a human being. Okay. All right. So the deficits of an individual could fall within social skills, functional skills, communication skills, academic skills, or motor skills. Okay. So when we talk about motor skills, we have two types that we work with. We have the fine motor, which is the coordination of the small muscles, like your hands, your fingers, the movement of your wrist. So those are the fine motors, and those are used for like writing, eating, putting things away, grabbing things, cutting. So we teach the individual how to use the fine motor if they're lacking or if they have deficits in that. When it comes to the gross motor, so those are the coordination of the larger or the bigger muscles. So like walking, running, jogging, things that you use the whole body, the movement of the bigger bones. So those are the gross motor. We teach the individuals if they're lacking in any regards using the coordination of the gross motor. Okay. The other one that we do also is communication skills. So communication skills doesn't really mean just you vocally or the individually vocally saying something. No, you can have a communication without you vocally saying things, because we can teach the individual to use sign language to communicate, picture exchange card, which we call the PECs, to exchange communicate. You can use pointing or touching things, or even your facial expressions is communication. So we teach the individual to use those appropriate behaviors for communication rather than the inappropriate behaviors. When it comes to the functional skills, this is when we teach the individual how to take shower, dress appropriately or independently, cleaning, things that are daily living skills that anybody would need to be able to live a quality life. So we teach that. And when we are teaching that, we make sure that the caregivers or the parents are involved, so that when we fade out, they will continue teaching the individual until they get to independency. Okay, we have what we also have the social skills, which is something that we all need. Okay, so those skills are the things that will lead us to make friends, have loved ones, being able to be around family gatherings and stuff like that. So we teach the individual to do like things like turn taking, sharing, cracking jokes and laughing at jokes, and understanding people's emotions and facial expressions. So those are social skills. The last but not the least is the academic skills. So this also, everything that we do is based off the individual's deficits and skill level, what they have in their repertoire and what they need to add on. So with academic skills, we can start teaching the smaller things that will lead to the larger things, right? So teaching you how to identify your letters and your numbers, and then that will lead you to actually being able to say them vocally or point to them and identify them. And then with the numbers, you can probably end up doing additions and subtractions, and as we go on, you progress, you go on and on. With the numbers, then that will also lead you to be able to identify your sight words, reading, identifying, being able to write your name, and so on. So everything that we do, or the BCBA does, they do it tailored to that particular individual that you assessed. We have curriculums, yes. You can pick and choose which programs to run with the individual, but you have to make sure you tweak it to that individual's level or skills. Okay, so if you're teaching someone to eat and they can't actually sit still, the first thing to do is to teach the kid or the individual how to be able to sit still at a table, and then you move on to the feeding skills. So everything that needs to be done before another behavior occurs needs to be corrected, and then you go to the next level. All right, so that's you teaching someone what to do. We do also the behavior reduction. Okay, so this is when the individual engages in problem behaviors like self-injurious behavior or any harmful behaviors towards someone else. Like I said in my function of behavior video, you need to know the function of the behavior before you can implement or write any behavior plan for that individual. We have the antecedent intervention and the consequence intervention. So with the antecedent intervention is you preventing the behavior from occurring. So whatever that you would do to stop the behavior from occurring is what we call the antecedent intervention. And that can be priming, what we call priming, meaning that you let the person know what is coming or what is supposed to be done before the behavior. So in that sense, you're trying to prevent the person in engaging in behavior that is not good or incorrect or inappropriate. You can also do the if-then or the pre-mark principle, which is you telling the person, if you do this, you get that. Okay, if you do this, then that. We also call that grandma's law or grandma's rule. All right. So that is the antecedent intervention. That's just an example of that. We have more. So the consequence intervention, that is when we actually implement the principles of ABA. So you do that after the behavior occurs. Okay, so that is the reinforcement procedure, the extension procedures, and then the punishment procedures. Always make sure you know the functions of the behavior before implementing anything. Okay, so that is the consequence intervention. ABA is huge. So the work of a BCBA is not just limited to dealing with individuals with intellectual or developmental disability. We do a lot of things based off your interest, based off your supervision, based off your training. You can work in different fields. You can work in the hospitals, in the forensic department. You can do organizational behavior management, which is OBM. You can use ABA for weight loss management in fitness, in sports, in schools. In ABA is life. You can use ABA in every field. Once you do it appropriately, you would definitely get a good result. Okay? So thank you for listening and watching me as always. If you're new to this channel, please don't forget to subscribe. Click on the notification bell so when I upload, you'll sure get a notification and watch my videos. And to my old viewers, please continue following me and watching my videos, sharing and liking it. Leave a comment or two. When I see it, I will definitely reply. So until my next video, stay safe, stay healthy, and God bless you.